The next areas we're going to look at regarding recording information is intensive care, menu choices and must assessment. If we click on record care plan information and then click more options, you can select intensive care from the menu. Here you can select the residents who we're monitoring for intensive care, and then you can select continue. And intensive care, what we're trying to do here is we're trying to record what levels of care we've applied for the resident at that particular time. And you can mark whether you've assisted them in these different areas. More importantly, you can enter a comment, and that comment can be as long as you want it to be. And of course you can red flag that comment so it will stay sticky on the handover notes. When you've recorded your intensive care, hit save changes, and that then is stored into the system. Another area of recording that we're going to talk about is menu choice. If you click on record care plan information and click more options, you'll notice at the top here there is menu choice. Now menu choice is driven based on the menu that's been assigned to that particular resident. If you click on the resident in question and then you click a particular time of day that you want the menu choice to be for, you'll then be presented with images from the menu for that particular time of day. And what you can do is select an item and add it to the resident's menu choice. When you've added all the items that you feel that resident has requested, you can then confirm the menu choice, and that will be stored and that will be seen within the kitchen management system for the cooks to use and to see. The final area we're going to look at in this video is the must assessment. The must stands for Malnutrition Universal Screening Tool. You can access the must assessment by clicking on record care plan information, more options, and then must assessment. Select the resident in question, and now what will happen is the system will calculate the resident's BMI, which it has done, and now it's asking us to fill out the rest of this information. And step 2 is what the weight loss score is for the resident, and the options are less than 5%, 5 to 10%, and more than 10%. It's unable to calculate this because we haven't got a historical view of the weight loss for this gentleman, so we're going to say less than 5%. And now you have a mitigating factor whether they have any acute disease, specifically if they have dementia and a decline in their dietary capacity. If you were to mark that, then you notice that the must now is scoring a 1, which is a medium risk and to observe. And it's prompting to say you could consider placing the service user on a food intake chart. If you were to tick this box, and when you hit save, the service user will be placed on a food intake chart. If you noticed, if we had changed the weight loss to a higher score, so the must scores at a higher level 2, this tick box is automatically ticked, and you'd have to actually deselect it to stop the service user going on to a food intake chart. If you're happy that your must has been completed correctly, you then can hit save, and that information will be stored into the care plan with a corresponding note available on the handover notes.